Currently, there are very few and scant data on MRD in Waldenström, mainly done by retrospective small series. In these days, we have presented some interesting data in our prospective WM study from the Italian Lymphoma Foundation, in which we studied MRD by a highly sensitive droplet digital PCR technique targeting the MYD88 mutation that is the hallmark of the disease. With these very specific techniques, we can track the MRD in peripheral blood or in plasma, in cell-free DNA, and we were able to identify at the end of the treatment those patients who are MRD negative and who will have a better progression-free survival, who will not relapse or relapse very late, in contrast to patients who are still MRD positive. That means that the therapy has worked but not so well, and they are going to relapse earlier. So new techniques like droplet digital PCR are really useful in this setting and will be utilized in the new trials, ongoing trials also of the network.